Okay, everybody. Part 3, the last chapter of our medical paternalism lectures. Oh, case study time. So just to recap, we looked at Alan Goldman's reasons for self-determination as a value, why we believe in autonomy and the right for everyone to make their own choices as long as they don't harm others, right? This is the classic ethical egoist perspective. Each person is the best judge of his or her own values, independent value of self-determination. Society flourishes when people pursue personal values and goals. Rising tide floats all boats, sort of thing. And in medicine, the right to self-determination is the right to be told the truth about one's condition, the right to accept, refuse, or withdraw from treatment after hearing alternatives and risks. And the idea is that misleading patients, lying to them, omitting information amounts to the use of force. We are going to look at the case for medical paternalism next time more. In the book, I forget what page hypertension's on. I think it's right. I think it's, is it before or after? It must be after. So there's a really good case study that is an interesting one because it seems like it's a nothing case, but it's also very much a something case on the justification for disclosing all possible side effects to a patient who is going to take an antihypertensive with a possible chance of, anyway, you look up case studies in the textbook, you'll find it in this chapter. And you can look at the issues on either side. This is a, and I'm going to upload this whole outline to Blackboard, so don't worry, I'll have these links. This is a link to a case where, it's basically this like type A businessman in his 50s who I think smokes and drinks, and he's way overdue for almost entire arterial blockage. And he needs, do I have it pulled up? I might even have it pulled up. Let's see. Yes, Ian Douglas. And basically, he needs to have a triple bypass surgery. And, Dr. Coral explains to him, he's like, no, it's imminent, right? And you have to do this, he's like, basically, doc, like, I'll just go to the gym, I'll quit smoking, I'll do it, but, I'm not going to have open heart surgery for these little chest pains. And it's an interesting question of like, he's clearly doesn't know what he's talking about, right? Danger's there, it's present, it's very similar to the erotic dancer who didn't want to have the surgery for the aneurysm. And it looks at the 4 criteria for DMC, decision-making capacity, which is a component of autonomy, and informed consent, which we're going to look at next, is a subcomponent of decision-making capacity. You have to have decision-making capacity in order to be able to exercise informed consent. And so I threw the 4 principles here. 1, to be able to understand the information about the condition and the choices available. Mr. Douglas understands it, to make a judgment about the information in keeping with his own personal values and goals, to understand the potential outcomes or consequences of different choices, and to freely communicate his wishes. So if he meets all of those, he should be in the clear. But the case I really want us to look at is the case on page 68. And I will read through it briefly, and then this is what I want our write-up to be on this week. And this will pretty much wrap. I'm going to have one more video on outlining like a 3-tiered approach to autonomy, which is very different than Kant's idea of autonomy, but, and then that'll be it for this week. So, Monica, a 49-year-old divorced mother of 2 in their early 20s, was admitted to the hospital for acute respiratory insufficiency on a Friday evening. She's a heavy smoker and had experienced dyspnea several weeks previously, but had not sought medical advice. Chest X-ray revealed several abnormalities, and a bronchoscopy was scheduled for Monday morning. On Saturday evening, Monica's difficulty breathing worsened, and during a heavy cough of sudden onset, she became cyanotic and nearly lost consciousness. The physician on call performed an emergency intubation and transferred her to an intensive care unit where she was heavily sedated. On Sunday, a bronchoscopy was performed, revealing a large tumor-like mass in her trachea. Biopsies were taken from the mass and from a palpable lymph node. On Monday, the pathologist confirmed the presence of tumor cells, and the diagnosis was made of a poorly differentiated squamous cell carcinoma of the lungs metastatic to the lymph node. Not good. The multidisciplinary treatment team agreed that the tumor is inoperable, can't operate on it, not by surgery or laser, and chemo and radiation therapy were of unproven benefit. So they're like, we don't know what to do. Monica can't be extubated, so they can't take the tube out of her throat, right? Because the tumor will immediately obstruct her airway, and a tracheostomy would be very risky and probably not feasible given the size of a tumor. Implanting a stent would be difficult with so advanced a tumor. The team believes Monica's life expectancy is no more than 3 months. So they're like, what do we do? They discussed the following alternatives for Monica's care. They could withdraw life-sustaining measures, continue mechanical ventilation and heavy sedation, but not treat any complications such as infection that might arise, persuade or coerce the surgeon to implant a stent without consulting Monica, or wake Monica so the team could discuss the diagnosis and prognosis with her and ascertain her preferences among the treatment alternatives. Pardon me. The team is concerned that Monica will not really be able to make an informed, autonomous decision if they work here. They worry that being intubated without sedation will impose further suffering for Monica, only to allow them to impart a grim prognosis. Should they wake her, or should they make treatment decisions on her behalf? And so this is a really interesting question, right? Like, the two commentaries are what I want us to have at, and I wish we were in class so we could do this in person, but, c'est la vie. Do we wake her and ask her what she wants to do? And those of you who immediately say yes, recognize that we're waking a woman who's going to be coming out heavily sedated. Anyone who knows people under sedation, are they going to, how conscious are they? How aware are they? Then they're going to have to titrate her medication, right? But she's got a tube in her throat, and so when she wakes up, it's very hard to always extubate people when you wake them up. So she's going to wake up confused, groggy, not having any awareness of this. You're going to have to keep this tube in her throat. She's going to start gagging out, right? She's going to be, and so you're going to explain to her, what are your options? You have 3 months either hand. You're going to be in pain. In order for her to think clearly, they're going to have to wean her down from the pain medication, which is going to increase her pain, which is going to be difficult to think, right? But you're going to, so it's like, on the flip side, you're just going to let her stay unconscious and ease things and watch the body slowly shut down or infection take over, right? How do you know she doesn't want those 3 months of groggy time to say goodbye, or make sure, take off some bucket lists, call a couple people, wrap up some things, make sure her affairs are in order, right? Are you ready to check out if you had to? If you just had a sudden coughing onset, went cyanotic, passed out, woke up, would you be capiche? And so, long story short, that's the case study I want us to look at. We will come back and you can look through some of this. I'm going to next week be assigning The Doctor, which is a fun movie, and I'm gonna have to figure out how to offer it. I'll have some free links which you can click to, but then there's a bunch of clickbait, so maybe I'll show people how to get it started for those of you who haven't ripped off movies on lesser known sites of the internet. Or I'll have a link so you can rent or buy it on YouTube for $4 or something. I apologize. Usually I show it in class. Just take a class to watch it. But it's good, and it walks through a ton of the stuff we're dealing with. So this will be our write-up on beneficence today or autonomy tomorrow. Take a look at the links. and check out the video on the 3 parts of autonomy. Otherwise, have a great week.